The UN Drug Agency has warned Southeast Asia could become the world's hub for synthetic drug production. Production and trafficking of such drugs has surged in the region despite a year of COVID-19 restrictions and border controls. And for a closer look, David Mathieson, independent consultant on Myanmar, joins us for more. Firstly, how have criminal syndicates adapted to the new normal of border restrictions amid the pandemic?
Well, they seem to have adapted really quite well. I mean, there was a slight dip in the early part of 2020, but then we've seen exports actually rise. And if you look at the UNODC report and where seizures were in Myanmar and neighbouring Thailand during 2020, they really are going through the roof. And also, really quite alarming, we're seeing transnational criminal networks actually spilling across borders going into Laos and Cambodia for production and transit. So overall, the pandemic has really been quite a boom for drug production and drug exports.
Well, certainly chaos can often bring opportunity in a situation like the pandemic. So how has the coup in Myanmar made the situation worse?
Well, I think the coup and the disorder that Myanmar is experiencing right now is only going to be a boon for transnational criminal organizations. And, you know, that kind of structured chaos is really good for illicit economies because they can actually move in and out of law enforcement agencies that are too busy quelling domestic unrest and also feeding on corruption that crises like this really fuel. And also, I think it's important to recognize that for many years, many decades, the drug trade in Myanmar, which is the biggest in Southeast Asia and East Asia, has really benefited from a symbiotic relationship between transnational criminal networks, militias, and the military that protects those militias. So I think the key really is that we should be worried that the military is back in absolute power in Myanmar, and that's only good news for transnational criminal networks and drug producers.
So what can other countries then do to try and mitigate this?
I think overall, if the region is serious about drug interdiction, it's not about making Myanmar and the State Administration Council and the Myanmar military a partner in drug interdiction. It's about recognizing that they are a serious impediment to forward-thinking drug interdiction. And so I think ASEAN and the region as a whole, East Asia as well, Japan, South Korea, Australia, all of these countries that are really suffering from this surge in drug production and exports to their country need to be serious about putting pressure on the Myanmar military to relinquish power and revert to civilian rule. The only way that you stop drug production and drug exports from Myanmar is to have a strong society and a military and a police force that actually respects the rule of law and actually goes after drug production instead of protecting it.
Many thanks for your thoughts this evening. David Mathieson, independent consultant on Myanmar.